What is pre-implantation genetic testing? Pre-implantation genetic testing, or PGT, is testing that can be performed on embryos that are created via IVF. The embryos are analyzed for specific genetic conditions that can be inherited and other chromosomal abnormalities before being transferred back to the uterus for implantation. This allows for the healthiest of embryos to be chosen for transfer to the uterus. PGT is not recommended in every case of IVF, but some situations in which PGT might be useful are when one or both the parents have or are carriers of a genetic condition that can be inherited, when the mother is older in age, usually over 37 years of age, when there is a history of recurrent miscarriages, and when previous IVF cycles have failed. There are two types of pre-implantation genetic testing. The first is PGT-A, or pre-implantation genetic testing for aneuploidy. This is sort of a screening test. In this, the embryos are evaluated for the number of chromosomes. Aneuploid embryos, that is, embryos with too few or too many chromosomes, are at a greater risk for implantation failure, for an increased risk of miscarriage, and can affect the future health of the baby. The risk of these is lower in embryos that have been screened using PGT-A, and this allows for the healthiest of embryos to be chosen for transfer. The second is PGT-M, or pre-implantation genetic testing for monogenic disorders. This involves testing the embryos for a specific disease and is done when one or both parents have a known genetic condition or when there is a family history of a genetic condition that can be inherited. This test reduces the risk of passing on that genetic condition. The test is specifically created for the disease in question. So if you are concerned about a heritable genetic condition, you are of an advanced maternal age, or have suffered recurrent miscarriages, discuss these with your doctor. This will allow them to give you the right advice about whether PGT is the right option for you and help you make an informed decision about your health and the health of your baby.